Hi, and welcome to this presentation about the experience of relational depth in remote and in-person therapy. My name is Rob. A little bit about me. First of all, there I am, looking quite studious there, possibly on the back of my 2 years studying counselling on the master's course at Bangor. During that time, I've completed quite a few hours on counselling placement, and I have experienced many times moments of what I described as moments of relational depth with my clients. So a little bit about the road ahead today for the next few minutes. I'm going to explore relational depth in terms of its meaning, how it's experienced, and its effect on therapy and therapeutic outcomes. We'll start to look at the modes of therapy and how they are impacted or impact relational depth. When I say modes, I mean whether the counselling is taking place in person or whether we are talking about remote modes of therapy, mainly phone or video. We'll go through the research leading to what we as a research group felt was the unanswered question about relational depth and therapeutic modes, and I'll walk you through the methods we used to explore the issues, the results we found, and what those results mean in terms of the future of the counselling profession, the impact on theory and practice, and some ideas of where we could go next in terms of further research. So, relational depth, what is it? It is arguably the most influential element of effective therapy. It's all about the quality of the relationship between the counsellor and client. And we are talking about momentary but profound experiences of connection where both client and counsellor really are authentic with each other and understanding each other at a very profound level. And it is argued that in that space, in that time, the client feels safe enough to be vulnerable and to open up and explore their issues with their therapist. Lockdown caused a big change, though, in counselling, didn't it? Counsellors had no choice but to switch to phones and screens to maintain services, but many are still working remotely since lockdowns ended, because from their own experience and from what they're reading, outcomes were showing to be effective for their clients. And there is a nascent body, small but growing body of research, which is finding similar benefits in terms of easing depression, anxiety and trauma in remote therapy. But is there a connection, is there a disconnection? Well, again, it is fairly new to research, but there is growing evidence, there is growing suggestion, should we say, that it is easier for clients to establish a working alliance with their therapists. But therapists as a body are more divided. They have concerns about feeling less engaged. There's that weaker sensory experience. It's much harder some feel to connect with someone when you're missing some of those non-verbal cues on a phone call or on a video when you can't see much of me today, can you? And there are technical challenges, screen freezes, people get tired of looking at screens after a while. But again, some research is pointing towards counsellors growing more comfortable and confident through experience by actually working online and getting used to it and starting to feel that they can form close working ties with their clients. So our study is really looking at the importance of the mode. Now many people are working remotely. Outcomes are good, but what is the effect on the relationship? So we wanted to study whether the mode of therapy is affecting moments of relational depth and how frequently they take place. Therapists do need guidance whether they have gained or lost in terms of building relationships since moving to remote therapies. And we wanted to discover how frequently both therapists and clients each experience these moments of relational depth, to answer the question whether such moments are experienced more frequently in remote or in-person therapy. and our prediction, our hypothesis, was that there will be no significant difference in the frequency for clients or therapists. So to the method, we set out to recruit 50 adult clients experiencing therapy and 50 practicing therapists. That included both qualified therapists and trainees on recognised courses and recognised placements. It was a quantitative empirical research using independent measures designed with distinct groups of therapists and clients. They were involved for each level of the independent variable, which was the therapy taking place remotely, and that was through phone or video or in person. The dependent variable was a questionnaire called the Relational Depth Frequency Scale, which is on the screen here. I will include it in the handout which I will issue alongside this presentation. But you can see on there it's a simple set of statements with a scale running from not at all up to most of the time. Statements for both counsellors and clients to answer. We were deeply connected to one another. It felt like a shared experience. I felt we were completely open with each other. You can see the kind of questions it's trying to explore there. And we wanted to make sure that everyone had a chance to establish a relationship. So to take part in the research, you had to have completed 6 sessions with either your counsellor or your client. And for therapists, we asked them to talk about their most recent clients, so they weren't choosing or picking a favourite client, and obviously asking whether or not the therapy took place in person or remotely. In terms of results, we had 47 therapists taking part. Of interest, this wasn't research into preferences, but experiences. 38 said they preferred to work in person. 4 said they preferred remote. 5 had no preference. For therapists, the score for in-person in terms of a number of moments of relational depth experience was higher than the remote score for remote counselling, and that was a statistically significant difference in terms of the experience. So we have got a significant outcome there. There's some numbers there in terms of the sample size and the average and the means, and in terms of where the therapy took place. There's a more detailed table in the handout. Of interest among the therapists, it was the in-person mean score for the trainees which attracted my attention. There was a statistically significant gap between remote and in-person for the trainees. They accounted for the significance in terms of the space between the two more than the qualified counsellors did. Certainly a higher score, an important higher score for in-person versus remote in terms of number of moments of relational depth. Though a 2-way ANOVA to examine the effect of experience and mode showed no statistically significant interaction. For clients, we had an outcome which, without any statistical significance between the mean scores for the in-person group and the remote groups. 25 clients took part in the research. Again, an outline of the table, the numbers there, far more information in the handout. So what do these results mean for therapists? Our predictions were based on research into the experience of working remotely. And therapists were overcoming their concerns and able to build alliances. We went one step further by actually comparing remote and in-person side by side. And there is a suggestion that however strong online relationships are, many counsellors still consider in-person relationships to be stronger. Remote therapy remains relatively novel, and maybe that some counsellors are still adapting to change, but it could be that for others, the lack of presence with their being in a space with their client, the technology being considered as a barrier may always be challenges for some therapists, and that does warrant further investigation. What do the results mean for clients? I think our findings really builds on the cited research into the importance of the relationship in effective therapy in terms of the client's experience and outcomes, and builds on the equivalence that was found in terms of outcomes experienced across different kinds of therapy. I think, though, our research, there are elements where future research can go deeper, particularly around gender. Our counsellor group actually matched the gender imbalance in the sector of 5 females to 1 male, but the client group did not accurately reflect the gender balance of those receiving mental health treatment in the UK. But certainly I feel that further examination of the frequency of deep connection according to gender and sexual identity would be of interest. And the other area worth exploring further would be in terms of mixed therapy. We decided to exclude participants who experienced therapy across different modes, and quite a few people did. But I think an investigation into how blended therapy compares with purely remote or in-person would be interesting, because through circumstance of experience, that is quite often what happens. It may well be that there are benefits to be had from experiencing a connection with counsellor, with client, face-to-face and remotely. Certainly worth some further research. I think in terms of the impacts of our research on client work, I think it's important to say that it gives confidence that counsellors and organisations supporting vulnerable people, they can now support people anywhere they are. We live in North Wales, where many people are excluded from services because they are living in isolated places with poor transport. They lack the funds, the financial means to access services. Illness and mobility issues may also prevent them from accessing face-to-face therapy, but they can have access to effective therapy and form close relationships with their therapist if they have access to a mobile phone or a laptop or both. I think in terms of, for therapists, we all need to set aside our doubts and really focus on ways to cultivate our therapeutic presence in those remote sessions and keep building our confidence up. I think that for trainees, the next research steps should look at which elements of remote research are improving or confounding the relationship, really to understand what's working, what isn't. And I think the next steps will be to really help trainees develop and reflect on ways in which they can enhance the bond with their clients, however they meet, and really understand how confident trainee therapists are in working with clients in an absence of sensory cues. I think it would also be interesting, we have access to some pretty basic technology here. Phones have been around for a long time, and so have video calls. But what else can communication technology offer to help clients feel engaged, understood and valued? There is some research into avatar work, which has facilitated virtual alliances, removing barriers to communication where clients are meeting in virtual spaces with their therapists, both represented as avatars. And I think the obvious next interesting step will be to understand to what degree people can form relationships with artificial intelligence. There are chatbots around, and there has been some research looking at how therapeutic bonds can be established between a client and a digital therapist. Not that I want to put us all out of work, but I think it is worth exploring. I'd go about this by creating a bit of side-by-side research again with one group of therapists working as avatars in a virtual counselling space, comparing that with a group working with a therapy chatbot and a control group in remote sessions. And again, using the relational depth frequency scale as a tool of measurement. But I would add on this time qualitative interviews to reflect on questions such as what it feels like to have a sense of contact with an intelligence which you know to be man-made. So just about wrapping up now, I'd like you to hang on to one thing from this presentation if you could. There are places where a counsellor and client who've never met can form an effective bond with moments of authentic and deep connection. And it could be here, well, maybe not a phone box, but I just thought a nice, bright, shiny red phone box was more memorable than a picture of a mobile phone. You catch my drift. I hope that, we can really work with people through a phone, through a screen, and really make a difference to help people make a big change in their lives. So it just leaves me to say thank you for your attention and interest today. Please do post your comments and questions below. We've got a window where we can accept and respond to questions. I will respond, and I will put into that chat details of how you can access a handout with lots more information and references. I'll post in the chat of how to access that. Thank you for your interest.